You're listening to the Turn Autism Around podcast. I'm your host, Dr. Mary Barbera, and today we have a guest talking all about ADHD and autism and how to tell if children have autism or ADHD or whether it's both. So Holly is a behavior analyst. She's also a licensed counselor and she can diagnose autism in the state of North Carolina. Holly is also an author, consultant, and specialized in autism for over 20 years. Holly is also the mother of two children, one on the spectrum and one with ADHD. So we talk about her parent and professional journey, as well as how to tell the difference between autism and ADHD. So let's get to that now. So Holly, thank you so much for spending some time with us today.
You're welcome. I'm super excited to be here.
Yeah, I don't think we've ever met in person or even, I feel like this is as in person as we're going to get during these COVID times. So I've been following your work and I know that you recently did an autism summit and I realized that we were already Facebook friends and kind of was looking into your background and I was like, I think you'd be a great guest. So we like to start out with describe your fall into the autism world. And I know you have both a professional fall and a parental fall as well.
I do. Since I can remember, Mary, I have been interested in people. I've been interested in why they do what they do and what seems to work better. I've also been doing little things since I was quite young. When I was in first grade, and this sounds so mean, and I apologize, I would never do this now, but it was Valentine's Day. And I decided to reward the kids in my class who were the nicest to me. And so I went into the coin jar at our house and I took out a quarter and I put it inside their Valentine if they were really nice. Now, there were a few people that got nothing. They didn't even get a penny, which was not nice at all. I got in trouble for that, by the way. But the people who I gave a quarter to, they became even nicer to me. And so that was sort of like, wow, there is something to this. And I just kept going through elementary school and just really paying attention to why does so-and-so have so many friends? What are they doing? What's different about them? And what about this person? And then I got into middle school. Now I'm in my mid 40s. Okay, closer to 50, honestly. But really there was a lot of separation between neurotypical people and neurodiverse people. And I remember seeing, people on the spectrum that I'd cross in the hallway and we had no classes together. And I didn't understand, like, why are we not together? And so really I started learning more about this population. And I knew I wanted to be in mental health and learn about more behavior with children on the spectrum and adults. I've worked with adults as well.
Nice. So you became a licensed counselor and did you become a behavior analyst right away or was that later?
I did. Okay. Because again, I am fascinated with people's behavior. I nerd out on that all the time. I'll watch people at the grocery store and it's borderline creepy. Like, why are they doing that? So, it's interesting. And I, again, was in mental health. My degree, I have a master's in clinical psychology as well. And so, wanting to go down that road of understanding as much I could about mental health and behavior in this population.
Okay. And then you had a parental fall into the autism world as well.
Yes. This is almost even a more interesting journey. So I have some health problems. I have severe Crohn's disease. I have an ileostomy. I've got a lot of things going on for those people who know what that is. It's kind of an interesting thing to have lost your large intestines and lots of other things I have to deal with. Wow. Because of a lot of these health problems, and also other things that came along with it. I wasn't able to have children biologically. So we were looking down the road of how do we adopt? Because I definitely wanted to be a mom. My husband wanted to be a dad. How do we make this happen? And we decided to adopt through foster care. And so our oldest son, we adopted him at age 6. And he is going to be 16 this month. And he is on the spectrum. He is what you consider level 2 if you're nerdy into diagnostics. So he level 2 and has severe ADHD. And then also we adopted our younger son. They're not biologically related. And he was 1 when we adopted him.
Okay. But he is not on the autism spectrum, your younger son.
He has severe ADHD and learning disabilities, but he is not on the spectrum.
Yeah, yeah. So did you know before you adopted your 6-year-old that he was on the spectrum?
Well, I had already been in this field for quite some time, so it was pretty obvious to me. But he had also been through quite a bit of trauma, so we needed to make sure we took care of that. When we went to the Child Protective Center, he was jumping from desk to desk of the social workers and screaming and throwing things and had a lot going on. So I'm like, yes, this is my kid. So we brought him home that night, and he's been with us ever since.
Does your husband have any kind of mental health background?
No.
But did that scare him? Like, this might be a little much.
I think it was a little bit scary, but I think it was because of what I already knew being in the field. And also we're like, we love this kid. Like as soon as we saw him. So we knew that he was just going to be our kid.
And he wasn't diagnosed with autism at that point. So you had to untangle kind of the trauma and all that. And then you had to seek a diagnosis for a 6 or 8-year-old. It's not easy either.
It's not easy. He had already been diagnosed with about everything. So reactive attachment disorder, ADHD, oppositional defiant disorder. I mean, PTSD, you name it, it was in there. But not ASD.
Yeah. When the developmental pediatrician diagnosed Lucas 2 decades ago, his name is Dr. James Copeland, who was on the podcast a while back. You can search for him. But I was like freaked out by the diagnosis. Of course, I was in denial for a long time before the diagnosis. And I said, well, what's kind of, is it necessary to pin this diagnosis on him? Even if he was 3 and, maybe it'll get better and that sort of thing. And he said, what he would see routinely is if you don't get a diagnosis of autism, you're gonna, or go shopping around to different doctors, you'll get a bunch of other diagnoses that may not be correct and won't really serve you well either. And I know we're going to talk a little bit about autism and ADHD, but Dr. Copeland really suggested that having autism is a spectrum, and you don't need all these other diagnoses like oppositional defiance or obsessive compulsive or even ADHD. And I know you probably don't agree with that. I'm not sure, but I do think now, 2 decades into this, there are medications and there are strategies for the ADHD that comes along with autism in some situations, that it might benefit from having both. But what are your thoughts on all of these diagnoses of your child, or whether it's a client, but like, especially the higher functioning kids, they tend to come in with quite a list of previous diagnoses.
They do. And that's an excellent question. I think of it like this. What does that child need? A diagnosis does not make this child different. It does not change them. It doesn't change their personality. It can be hard, though. It can be hard for parents. I'm one of them. It can be really tough. But the thing is this, what I find, and I've seen hundreds and hundreds of children. I've been, working with children with ASD for, I think, 23 years now. People understand them more. They're able to, it opens the doors to more services.
Definitely.
It's unfortunate that if you have a child that's diagnosed with ADHD, but also meets criteria for ASD, but they don't have the ASD diagnosis, it seems like they don't get what they need as much. And it's unfortunate, but that's true. I hope that changes at some point, but it's just not that way now. And so it is a label, but if the child meets criteria for ASD, again, they're still the awesome kid they've always been. But I find that professionals, teachers, other people can understand them more, and that is incredibly important.
Yeah, and definitely with services, because of the work of many autism parents and advocates, some of whom are lawyers, like Lori Unum was on a previous podcast, and she went around the country through Autism Speaks for legal reform for coverage for ABA services for children with autism. So that's one of the big differences I see is kids with just ADHD who don't meet the criteria for autism or don't have the autism diagnosis have a very difficult time getting any kind of ABA services, which is critical as another one behavior analyst to another, for sure.
It is. And, it's unfortunate. And hopefully, again, that will change. Applied behavior analysis can be so effective for so many people. Anytime we praise as a parent or say great job to a colleague, this is not just for children on the spectrum. So I think that is important. Early diagnosis, the most important, certainly. But I do find that children do get more of the help they need once they have the diagnosis.
Yeah. And just to tie in another thing of, ABA is a science. It's the science of changing socially significant behavior. And it seems like a lot of the neurodiverse crowd or the ADHD parents or professionals even really have a problem with ABA and don't appreciate the power of ABA, saying like, we don't do ABA, we don't do reinforcement. It's like, as a behavior analyst, it seems so like, how do you respond to things like that? Like,
well, I think that it's a question of just understanding. What I say, and this might sound circular, but I guess it is in some ways, is we are where we are when we're there. I thought mistakenly when I was a new behavior analyst, I knew everything. I knew everything, right? And I think that's where we all are kind of when we're younger. And I thought, I knew this, I knew everything until I became the parent. That was a whole nother level of understanding. I think, again, we know what we know when we know it. And if you are using any kind of sticker chart or point system, there's tons of whole behavior classroom management approaches that use that. That's the science. So you can call it, I guess, whatever you want to, whatever makes you feel comfortable, but that is, trying to increase behavior that maybe that child was struggling with, and they will be able to get more reinforcement this way. But I think there's some semantics and they just get a little bit confusing.
Yeah. Like some people, some parenting experts are like, we don't use threats or punishment. I'm like, yes, good.
I don't either.
And we don't use any rewards or reinforcement. I'm like, whoa. Like, whether you think you use it or not, everything is about I mean, even our listeners listening to this, they're listening because something we're saying is somewhat interesting or reinforcing to them. Otherwise, you wouldn't be listening. If you're walking right now, you wouldn't be walking unless there is some benefit to you. It is
And we
providing
all,
some kind of reinforcement.
absolutely. And then as far as even, decreasing behavior, yesterday, my husband does not like things in the sink. And I left a mug in there and he was pretty upset. And because of his reaction and my feeling to that reaction, I'm going to pay better attention to put the mug in the dishwasher. So, again, I think it's just the understanding of how behavior works and what we do, and maybe we don't understand quite what we do when we're talking about reinforcement and decreasing and increasing behavior. But really, we all do it, and all humans do.
Right, right. So let's talk a little bit about your younger son, who was only a year when you adopted him and went on to get a diagnosis of ADHD. So, well, I just told you before we hit record that I have a new book coming out at the end of March in time for Autism Awareness Month. It's called Turn Autism Around, and it is for parents of very young children with signs of autism, which signs of autism in my book and in my mind, can be signs of ADHD too, can be signs of learning challenges, or we don't know what it's going to be. And maybe young children, maybe a young child does have a diagnosis of one or more of these things, but it's really, in my experience and background, very, very difficult to tell what it is when a child is 1 or 2, 18 months, those sorts of ages. So when you adopted your son when he was 1, and so what were some of the earliest signs you saw that showed you that maybe he was going to have some diagnosis underway?
Sure. The adoption journey is, for any of you listening that have been through that, it's incredible. And I just realized this is, I think so many of you are going to appreciate this. I've got my mommy needs sleep mug for my third cup of coffee right now. So that just tells you a little bit. And I think a lot of us can relate, right? So my youngest, again, we got him at 3 months. And when you adopt through foster care, it's a very different experience. My oldest son came to live with us when he came into custody at 4, and we adopted him at 6. It took 2 years of court to make that happen. And then for our youngest son, we were able to adopt him at 1. What we noticed was there were a little bit of a speech delay just by a few months, nothing very significant. A little bit of motor differences, fine motor differences that we noticed. Also some emotional regulation differences that are, hopefully when they update the diagnostic manual, ADHD, it will be more clear in the diagnostic criteria about the emotional differences that come with ADHD. So I knew something was different for him. And then obviously I do this for a living. So I knew that he was going to have learning differences and ADHD prior to the diagnosis. But we did, get him got him diagnosed early, because I think early diagnosis is extremely important. It can open the door to services. So for him, he had occupational therapy for fine motor skills. He has a lot of writing differences that can be pretty frustrating for him. So we put some accommodations in for him. And again, how we interact and what our expectations are, and having to go with the flow with both boys. So it's been a journey.
Yeah. Now, are your boys on medications, and did you struggle with that?
Oh goodness, I did. And it's hard to be a parent, period. It is. But when you're a parent of differently wired children, that's a whole nother level. I did my undergraduate honors thesis on parenting stress in parents of differently wired kids. And literally it's off the chart of the parent stress
Mm-hmm.
index. I
Oh,
mean,
yeah.
literally. So that kind of tells you, how that is anyway. But when you are also a professional, because I know you have a lot of audience that is professional as well, there's this expectation that we have of ourselves that I should be able to do all the things perfectly. I should be able to have the best behaved kids that have ever entered Walmart or whatever that looks like. So I think we need to just kind of give ourselves grace. It's not easy. And we have to understand our kids, what they need, but we also have to understand that, we can do the best we can, just like they can do the best they can. But yes, having two kids that are differently wired it can be really tough, and it's tough on them.
Yeah, yeah. I did do a paper which we can link in the show notes. It is called The Experiences of Autism Moms Who Become Behavior Analysts. And it's a qualitative study I did when I was pursuing my PhD. So even though you were a BCBA before you became an autism mom, yeah, I think you'll appreciate some of that. And some of that is, once you become a mom to children on the spectrum, you really do see things. You can see things from both
Yes.
as a professional and as a parent. But, when I would go into schools working through the Verbal Behavior Project for the first 7 years of my career, if a teacher would say like, they come and their shoes, they just keep taking off their shoes. I told mom she needs to get new shoes, or, it's like almost like a little blame on the parent, or,
Sure.
and it's like, I would always defend the parent because, like Lucas used to take off his shoes like obsessively. And it was like, I would, just keep trying different shoes, and it's hard as a parent. Or if a child would be having problem behaviors or anything at school, I'd be like, what do this child do all weekend long? Like, what I would just like to see how they're engaging themselves, or like how much supervision they must need for them to even be safe. And so I think as both a parent and professional, we have the advantage of being able to see both sides. And I can also see sides where, a parent is having unrealistic expectations and, being very demanding. Like, we all need 8 positives to every negative. So, when I'm interacting with my son or my clients, but also when I'm interacting in the past, when Lucas went to school, with his school district staff, they need 8 positives to every negative too. And if I'm like, where's that data? I don't like the fact that he came home with marker all over his hand. He seems to have a mark on his arm. Like, if you're delivering that kind of negativity to the school, it's going to be hard to have a team approach where you're just moving forward in a positive way.
Wow, you just touched on so many important things. Like, I just was thinking, whoa, I want to talk about that. Um, One of the first things before I go into talking to parents and teachers and how that all interacts, because it's absolutely true, everything you said. My first experience with parent shaming, it was new to me, and I know the parents listening are going to say yes. They know one of the first times that it happened because it's dramatic. When our son came to live with us, he had these shoes that had holes in them and they didn't fit him. And, I was new to parenting. This was my first baby. That's one way to get into parenting, let me tell you. So he really had to be fitted. I took him to the mall, which was his first experience at the mall by myself. Probably not the best idea. And so he was hiding under one of the benches. We're waiting for his feet to be measured. And another child thought that looked fun, apparently, and also hid under another bench. And the mother yelled at her child and said, "You better not go under there. Some people just don't know how to parent." And I was shocked. Mary, I do this for a living. You don't know our story? This kid's been through more than you'll be through in a lifetime, and just, and I probably would have been arrested if I didn't have some kind of internal speech to be able to work through my checklist and say, that wouldn't be good, Holly, So I stayed quiet because that would have just stressed him, my son. So I'm like, keep it together. Just keep it together. And so, being on that side of parenting when first starting as a professional, that was something. It was quite a different experience. There was a time where, he had been in grocery stores before, but he was taught to steal. And so that was very difficult at first, obviously. So as a behavior expert, we're going to set him up for success. We're only going to go in. We're going to get one thing. I've got a picture of that one thing. I know exactly where it is. And if he walks next to me, because he was a rudder, if he walks next to me, he's going to be able to check out. And so we had planned this, prepped him, role played. You bet it, we did it. And we went in. It was all going well, and he took off. And so, like, okay, come back. We're going to practice this. We're going to do some positive practice. We're going to get this done. And then we were leaving, but he didn't earn it. But he was going to be able to earn it. We were going to come right back in and do it again. So he got the opportunity to. I was going to set him up for success. He decided he wanted this finger candy ring. I have traumatic experience every time I see one to this day. He was screaming, freaking out, rolling around on the floor. People came out from the aisles to watch. I mean, people stopped shopping to watch this tantrum. It was so amazing. And so I was impressed even. And I'd seen thousands of tantrums. So he's circling, all over the place. I had strangers come up to me and offer to buy it for him. Strangers. Multiple strangers. And I said, I've got this. Thank you. He grabbed it, jumped in the air. This is amazing. I wish I had the video. Jumped in the air and actually swung it across the scanner, and it beeped. And the person checking us out was horrified. Okay, because they see all this going down. And he's like, I got it. And I said, well, no. And so she had to undo it. And then we left. And then, of course, we did it again. He did great. But, on that parent side, it is a whole different ballgame. It really is. And I can see why it'd just be give it to him. Right? Because it was embarrassing. I mean, people were coming up to us, strangers. So when you're walking through that journey, and again, being both a professional and a parent, I think you really do have a special lens that you can look through. As a parent, I am absolutely more in tune, as I should be, with the parent part of all this. Oftentimes there is blame. And again, people do what they do when they do it. They know what they know when they know it. So if you have a teacher, they're frustrated, they're exhausted, they're overworked, you may hear the word refuse. Your child's refusing. Or your child ran out of class. Or you didn't get all that homework done. And so you feel defensive because you want to defend your child, but you also feel, blamed at the same time. And it can set up some really difficult interactions between the school and home. So I feel like when you go and just ask some simple, non-judgmental, being very mindful of yourself, whether you're a teacher, a BCBA, a psychologist, a parent whoever, and say, what does this child telling us they need? When you come back to that, it always gets better. What does this parent need? What does this teacher need? When you come from that perspective, it's a lot harder to have these big feelings and big judgments that could come up, because we all have judgments. We're all human. It happens. But it's lovely how you can really step back and ask that simple question and start doing some good work.
Yeah, the whole ring candy, while you were describing that incident, I thought, a lot of parents on anywhere in any Facebook group, even in my closed Facebook groups and my Q&A calls with my members, once it gets to that point where they want to know what to do the next time he throws a fit at the store, even as behavior analysts, that is a dance. And
it is.
When we have big outbursts like that, it's not a very win-win situation. In the end, it turned out okay because you knew what you were doing and you practiced it and you came back in and you did it again. But very few parents would be able to navigate that and do it in any way correctly, so that as to not cause harm or cause whatever. And I feel like, my message is really, I'm sure you're going to agree with this, is like, we want to teach parents how to prevent it, how to go in the store for one thing. And, but once you get into a full blown meltdown, like, that's something that it's not just getting a tip from this show or whatever. Like if these meltdowns are daily or very, if you have a large child and the meltdowns can cause serious injury, you really need some help, and some help from a behavior analyst or somebody that knows what they're doing, because even I could picture myself, and I'm running through scenarios in my mind of different incidences that happened with my own child or my clients when I was like involved. And it's like, wow, this behavior stuff is really hard.
It is so hard. And I do not recommend, I do not recommend doing what I did if you hadn't done all that legwork and had an expert helping you. I would not. Because like you said, Marian, it's so important. If a child is in that full, it's just about keeping them safe, getting them comfortable. It is just about that first, always. And so I'm glad you brought that up, because that is not easy. And that was a lot of work leading up to even walking in that store.
Yeah. Yeah. And it might even involve buying the candy and getting out of there, or getting your child into a safe position and trying again next time with more proactive.
Like you said, it might even be that situation where it's that dance. Now, in that situation, I knew the environment. I knew exactly what I needed to do. But it could have been the case where I had him hold it. We went back and got another item and then came back. I mean, there are lots of nuances. There are lots of things that can happen. So it's not a time to have a big, massive event in public that could possibly be unsafe. The only reason why I did that is I knew exactly what to do, and I had a lot of pre-work going into it.
Right. And you knew you were going to turn around and it was going to be successful with the next time. And a lot of parents without behavioral background would be like, they would get out, they'd be in a full blown sweat and they'd be like, I'm not going back there ever again, and so my big thing is safety and just preventing.
Yes, always.
And that's, I knew that you would totally agree with me, but this is where, and even if we had 5 behavior analysts looking at the video after the fact, we'd probably have 5 different opinions. And it's like, on exactly, in some ways it's kind of like a jump rope. Like you kind of have to jump in, and sometimes you miss that window and now you're if you jump in, you're going to end up reinforcing the wrong thing.
Yes.
It's quite complicated.
It is complicated, and it happens. There is no perfect parent, including me. There isn't. And I do this for a living.
Yeah.
And I'm not going to
it's hard.
It is, because we're all human, and I think we just need to be gentle with ourselves. Like, we're learning our kids and, what they need and how they need it, and how much work on the front end that they need. Obviously he was also little, and that's
a big point.
Now he is now 180 pounds, and that's a different story. So that's always something to think about.
Yes, he was small, and he was pretty verbal.
Yep.
And he, lots of variables. So I'm glad we talked about all those variables. In my article on the autism mom becoming behavior analyst, I know one of the big positives that the 6 women reported was they knew how to treat problem behavior, and they knew how to prevent problem behavior, which really turned things around. They knew that they could change behavior, and that they had the skills. And so parent training on reduction of problem behavior skills is really what they recommended in the end, which is really the whole point of the podcast.
And I think
okay, let's move.
Yeah.
I'm sorry?
That's important too. If I wouldn't have already been a professional in the field, that is the first thing I would do, was to get parent training. Absolutely.
Yeah. So you do actually diagnose kids with autism, and rule out autism in some kids, and diagnose kids with ADHD and rule out ADHD or autism in other kids. So that's really fascinating. And we talked right before we hit record about you don't do IQ testing and achievement testing, which is recommended for kids 5 and older.
Yeah.
But if you have if you're a really young kid, not to. Go ahead.
Yes, I know how to do it, but I don't care to do it, if that makes sense. I think we all have our preferences in our work environment. And I do know how to do those tests, but I do rather, if I'm testing someone who's older, I rather them have IQ and achievement testing prior to, because there might be a learning difference and that we can't ignore, and we definitely need to know that. Now with the younger kids, like you were saying, when they're 1, IQ testing probably doesn't make so much sense for them.
No, in fact, I would really caution against IQ testing before the age of 5, especially when you are not verbal or minimally verbal, because what happened to me was a month before Lucas was diagnosed with moderate to severe autism, the Birth to 3 agency said, well, we can send you to a psychologist. And he gave the diagnosis of, at the time, this is 2 decades ago, PDD-NOS, and, which is kind of like mild autism, but he was, I was crying. He was like, well, I could give him a diagnosis of like childhood schizophrenia. I'm like looking at this guy like, what are you talking? Like, he was so outdated with his knowledge. But when I got the paperwork, Lucas is 3, like and he regressed. So I had visions of him being like a genius, and no problems. Then all of a sudden, okay, now he has autism. When I got the paperwork from the psychologist, who was pretty outdated, he actually gave Lucas an IQ test and an IQ score. And so on the paperwork, it said PDD-NOS, which was, to me, very devastating, but also mild mental retardation, which he hadn't disclosed that he was even doing an IQ test.
Oh, interesting.
I mean, Lucas was like sitting on my lap, wriggly, couldn't really talk. And then when I asked him, I said, well, I have an appointment with Children's Hospital to see a developmental pediatrician in a month. Should I go there? And he's like, why? They're going to tell you the same thing I just told you.
Oh,
Like,
good.
why would you go there? Yeah, like
I'm so sorry.
really bad. But when I got to CHOP with Dr. Copeland, I asked him about this IQ, and he said, through a children's hospital, he said, we would not do an IQ test or consider an IQ score valid until at least the age of 5 for a child with severe language impairments, especially.
Right.
So that is kind of my gut. And now you're a professional, you do this for a living. Like, do you agree with that, or you?
Absolutely agree. I mean, you can
Okay.
do it before that, but I feel like once you're looking at around 5, it's going to be more reliable and valid. We want a good test, right? Or that child isn't testing for no reason, and it's not going to be accurate. You don't want to base recommendations on something that's not accurate. So yes, I agree.
Yeah. And I
But
do think
thankfully,
that,
we can diagnose autism earlier, than 5. So you don't
right.
have to wait to get that evaluation.
Yeah. So is there something specific that you look for, say, in a 2-year-old that comes in to rule out autism versus ADHD?
ADHD is really interesting, especially in young kids, because they're so active. They're not sitting in a seat for academics. It can be really, really hard. Now, usually you're not going to be diagnosing ADHD at that young age. However, ASD, that can look different when you're looking at, severe speech differences, playing differences. How are they using toys? How are they using language? What are they pointing? Is there joint attention? I mean, there's just so many things to look at. Are they engaging in any self-stimulatory behavior? So those are types of things that we can see sometimes pretty early on. I mean, I've diagnosed children before age of 2.
Mm-hmm. Yeah. And you do also use the ADOS test, which I think I did a video blog on. And you interview the parents. If the child's at daycare or preschool, you interview them or have them fill out checklists. So you really do diagnose. Um, so, but the treatments, in my opinion, are pretty much the same if you are young, like in terms of parent training on teaching imitation, teaching that caregiver back and forth dyad, um, teaching babbling, pairing up learning so that it's fun, reducing problem behaviors around not just talking and things like that, but also going to doctors and dentists and sleeping and eating and potty training and all the problem behaviors that
There's a
get in the
lot.
way, which is all what my new book is all on. But I think, if I had a 2-year-old that it was, well, I'm not sure if it's ADHD, it's going to be a learning difference. It's going to be just a speech delay. It's going to be autism. And a lot of times those people are standing in line waiting. So my whole thing is treat it. Some psychologist told me once, treat it like it's the most severe autism in the world. And you won't then think, oh, I should have done more. Like it seems like people that have higher language kids tend to not dive in so much, well,
And
maybe they'll just.
and I can see why. A lot of pediatricians are really skilled in understanding and doing screenings for autism, but some aren't, because pediatricians are supposed to know a lot about a ton of things. And sometimes I'll hear from parents that come to see me is, we didn't know, and there's that guilt there, and it's hard. When a pediatrician says, well, they'll catch up, come back in a year, and then we've missed that, yet another window of helping. So it can be hard, and sometimes there's a lot of parent guilt there, and that's understandable. It's so hard
Yeah.
doing this parenting thing.
Yeah. But like you said, the earlier you can identify what the problem
Absolutely.
is, if they meet the criteria for autism, and if you are not waiting in line, get the diagnosis, get the treatment, learn more. You don't have to learn everything overnight. We're both parents and behavior analysts with decades of experience. And, just take baby steps in the right direction, and you will learn as much as possible so that your child can, reach their fullest potential, whatever that is.
Absolutely.
Yeah. So we are wrapping up. We need to wrap up because we're getting close to the top of the hour. So part of my podcast goals are for parents and professionals to be less stressed and lead happier lives. So I know we talked a little bit about this, but do you have any stress management tips or self-care that you have used over the years that you would advise for our listeners?
Well, first you want to get yourself a mug or something, right, to carry around. I feel like we need to be more gentle with ourselves. And I said this earlier, I cannot stress that enough. You are going to have your own meltdown. It's not if you will, you will. it's when, and that's okay. And, loving on yourself, knowing that you're doing the best you can in that moment, and not beating yourself up about what you should have done or what you could have done, that doesn't serve you. It does not serve you. So I always say, do the best that you can in each moment. And when you don't, be gentle with yourself. And that's, again, it's okay. You are going to be okay, and you are not alone. And these are one of those podcasts that can help you feel not so alone as well. Get support around you, join groups. There's so many beautiful things out there to get support. Don't be alone. Don't isolate yourself. Love on yourself, forgive yourself, and take a breath.
Yeah. I think that's great advice. And people can learn more about you at hollyblancmoses.com. You have a podcast, which I just found out about, called Wired Differently. And you also sell some courses online. So Holly Blanc Moses, it's been a true pleasure to get to know you better. I'm sure we're going to be in touch in the future. And I really wish you the best.
Thank you so much, Mary. I appreciate it. Take care, everybody.